from the station that's on your side. This is Channel 7 News Good Morning Arkansas.
Oh, well, it is baseball season and no one wants an injury to keep them out of the game. No one knows that better than orthopedic sports medicine specialist Dr. Adam Smitherman, and also Zach Jackson, who is with him this morning. He's a high school player for Bryant High School, the pitcher there. Welcome. Welcome to both of you, by the way. Let's start with your story, Zach, because you did have an injury. How did it happen, or how did you know something was wrong?
Well, it was my sophomore season. I was playing Legion ball with the Bryant Black Sox, actually.
Okay.
And we were playing a game, and my arm was a little sore kind of weeks before, so I just sit out, and then I was like, I'm so competitive, I can't sit out no more, I have to throw. And so, I was throwing loose, and my arm felt good. Get out there to the game, and I'm throwing, and everything feels fine. And then, I'm pretty sure it was the fourth inning. My best pitch is a cutter. That's what I throw. It's fastball, cutter, cutter. And so I get out there and I get around my cutter, and then I felt kind of like a little pop and kind of hurt a little thing. And I was like,
elbow?
Yes, ma'am. And then I was like, maybe it's just sore. Let me throw a fastball to see. So the next pitch, my catcher actually called another cutter, and I was like, no, we got to call fastball. And so I threw the fastball, and it barely made it to the plate. And I was like, I gotta get out.
Yeah, something was wrong. Talk a little bit about what injury he was feeling, and is this common?
So yes, it's very common. And the injury that he had was a tear of a really strong ligament on the inside part of your elbow called the ulnar collateral ligament, or UCL. It's common because that ligament is the strongest thing that keeps our elbow from sort of opening up more than it ought to when we throw. Throwers are really the only people who get it. So baseball pitchers, catchers, javelin throwers at the collegiate level, so people who put a lot of force across the elbow. It's becoming more common, but maybe it's because we're more aware of it. We pick it up more earlier than we maybe did in the past. So it's really hard to say how often does it happen, but we know that the rate has increased at about 200% for the past 10 years.
Good deal. Okay, so what are you thinking about your baseball career at this point, and then how did you end up at Ortho Arkansas?
Oh, as of right now, it's going well. I felt much better. I feel like a different person when I'm out there on the mound.
Yeah.
And, without Krista Finney, our trainer, I probably wouldn't have even went to Ortho, but she always suggests, she's always like, go, go, go. And then I went there and met Dr. Smitherman over here, and he was just 100% the guy I liked. I went and visited several other doctors whenever I got the news because I didn't want to have the surgery, so I was like, well, maybe I don't have to. And then he was the guy that I liked best, and I trust, and I was like, he's going to get me back out there on the mound.
Yeah, so what kind of surgery? He had to have surgery, right?
Unfortunately for his case, he had to have it. If you've torn that thing, it just doesn't heal on its own because it doesn't have a very good blood supply. So because of that, we have to make a new ligament. And that means we have to get some tissue from somewhere else. Most of the time we get it from the forearm. For you, we weren't able to do that. We had to get it from his hamstring. We go into the elbow, the place where the ligament normally lives, and we create a new one through a surgery. You go home the same day, but the really big deal with this surgery is the recovery time. It takes forever to get back to normal, like Zach knows. For the first 3 months, we don't even let you lift weights. Around that point, you can get into the weight room, but it's about 4 months before you can begin this thing that we call a throwing program, and that's this very graduated way of getting back into throwing, focusing on mechanics and strengthening. And for most people, it's about 6 months before we start to begin with real velocity throws. And I think probably the guys would tell you it's 9 or 10 months before you're normal, before you're back doing it.
You are back in the game now, and you had one really good game. You want to tell them about that one?
Oh, yes, ma'am. I threw a perfect game.
A no-hitter? Is that how you say it?
It's a perfect game.
Perfect game.
Yes, ma'am.
How long ago was that?
2 weeks ago. It was our first game of the season. So we opened the season out with the perfect game, and it wasn't just me. My defense, first baseman Aaron Oranger, he made some good plays all around the whole team. We hit the ball well, played defense, and then I guess that's how you have to win the games.
But I know they were glad Zach was back for
yes,
this season. Quickly, just kind of some of the prevention that they can do. We're going to look at the website, but what are some of the things players can do to prevent this?
Probably the most important thing is early on when players are learning how to throw, really focusing on mechanics. And that comes down to youth league baseball coaches learning about it, reading about it, and teaching proper mechanics. The second really big thing is not overusing the arm in a particular season. We define that as pitching with less than 4 days of rest rest, and we see it all the time, both at the junior high and high school level and in recreational league baseball. Lots of times today, kids are on multiple teams, are on showcase teams and high school teams in their summer league, so they're playing almost year-round, and it's really imperative to give your arm some breaks and rest. And then the third thing is really being strict about pitch counts. And pitch counts are the number of pitches that it's safe to pitch for a particular player at his age level. And there's some really strict guidelines that you can get online at the American Academy of Sports Medicine or through calling Ortho Arkansas that can really sort of give you an idea for how many pitches are safe for your player.
Let's put up the information about Ortho Arkansas, and congratulations on being back,
Thank you.
Zach. You can always check out with them if you have any injuries, whether it's, elbow or something else. There's the information on Baptist and, of course, Ortho Arkansas with the great doctors there that can help you as well. And just another amazing Arkansas story. Thank you. Good luck.
Thank you.
For the rest of the season. Thank you, doctor.
Thank you very much.